Kimani Kuria.
Thank you very much, Madam Speaker. And from the onset, I would like to congratulate my chairperson of the Committee of Finance and National Planning for coming up with this very great bill. Madam Speaker, I would like to start from the onset that this Kenya has invested a lot in infrastructure. Infrastructure meaning buildings. If you go to every constituency, every county, each governor is building a dispensary here and another dispensary there. The next thing they've done, Madam Speaker, with the help of the Ministry of Health, is to buy a lot of equipment. And no wonder we have the current case of the MES equipment that has been supplied across the county. When I was having the Committee of Public Accounts Committee, Madam Chair, you and I had the privilege of visiting some of these hospitals across the country. And go to a very small dispensary somewhere in Siaya that has all this equipment worth millions of shillings. But Madam Speaker, the surprise was there was no personnel to operate this equipment. And therefore, Madam Speaker, the bill by the Honorable Wanga that says we must hire these professionals, we must train them. This is the only way we are going to fight this cancer and streamline our health sector. I think it's probably because it's very easy to get quick bucks on these constructions and buying of this equipment, and probably not the same if we are recruiting these professionals. And that's why probably the emphasis has not been on this personnel, Madam Speaker. I'm a little disappointed at what COVID has done to this country. Not just that it has exposed the rottenness of our health sector, but most importantly, for the last few months, the Ministry of Health has been reduced to the Ministry of COVID, the Ministry of Corona. Madam Speaker, even though this is a pandemic that you know has an impact of affecting very many people and causing very many deaths, cancer alone, Madam Speaker, kills 30,000 people every year. So in as much as we are very afraid of COVID, we have recorded around 500 deaths in 6 months. But we continue to kill 30,000 people every year. And I'm thinking, if the emphasis of reporting, of contact tracing, of monitoring the behavior of COVID is the same that we use for the other infectious diseases that we know can be prevented, can be treated, would be the same way we've given this COVID thing attention, then I think cancer would be a thing of the past for this country. So I'm looking forward to, even after COVID, to a time when we'll have a weekly address, a fortnightly address, a monthly address by the Minister for Health, saying this is how we have dealt with cancer, this is how we have dealt with malaria, this is how we are dealing with diarrhea, this is how we are dealing with HIV, because these diseases are killing many more Kenyans than COVID ever will, even if it would transmit as much as it has done in other countries, Madam Speaker. The issue of e-health cannot be more timely. We have seen, Madam Speaker, that during this COVID, even Parliament, when we thought we could not address our business virtually, we have done a lot of committee sittings. We've transacted a lot of business in the comfort of office, in the comfort of our homes. This shows that ICT is the way to go. And not just in terms of holding our meetings by Zoom, but even in terms of healthcare, in terms of tourism, in terms of education, and every sector. And therefore, this bill cannot be more timely. Let us encourage Honorable Wanga, let us support this bill, let us pass it, and most importantly, let's see its implementation towards curing this disease, this monster called cancer in this country for once and for all. Thank you.